When thinking of muscles of the lower arm, we have some rules that we can follow so as to work out the actions a little simpler. In working out actions of these muscles, remember these simple rules. If a muscle is on the anterior surface, it flexes. If it's on the posterior surface, it extends. If it inserts laterally, it abducts. If it inserts medially, it adducts. And if it pronates or supinates, it's in the name. The upper arm is located between the shoulder joint and the elbow joint. We can categorise into anterior and posterior compartments. In the anterior compartment, there are two muscles we are concerned with. They are the biceps brachii and brachialis. Biceps brachii is a two-headed muscle. The long head originates from the superior portion of the glenoid fossa of the scapula, and the short head originates from the coracoid process of the scapula. Both heads insert distally into the radial tuberosity. There are two actions for this muscle. Note there are no actions at the shoulder, as the biceps brachii help to stabilise only at this joint. The brachialis muscle lies deep to the biceps brachii. It has a large muscle belly, which makes it more powerful than biceps. It originates from the medial and lateral surfaces of the humeral shaft and inserts into the ulna just distal to the elbow joint. This muscle has one action. The posterior compartment of the upper arm contains the triceps brachii muscle, which has three heads: the long head, the lateral head, and the medial head. The long head originates from the inferior portion of the glenoid fossa, the lateral head originates from the humerus, and the medial head originates from the humerus also. Distally, the heads converge onto one tendon and insert into the olecranon of the ulna. There is one action of this muscle. There are many muscles in the forearm. In the anterior compartment, they are split into three categories: superficial, intermediate, and deep. The superficial muscles in the anterior compartment are the flexor carpi ulnaris, palmaris longus, flexor carpi radialis, and pronator teres. They all originate from a common tendon, which arises from the medial epicondyle of the humerus. Flexor carpi ulnaris passes across the wrist and attaches medially to the carpals. It has two actions, one of which is in its name. What's the other action? Palmaris longus is a muscle that's absent in about 14% of the population, which is a great example of anatomical variation. It attaches to the fascia of the wrist, which helps to keep tendons in place. It has one weak action. Flexor carpi radialis attaches to the base of metacarpals 2 and 3. It has two actions, one of which is in its name. Pronator teres has two origins, one from the medial epicondyle and the other from the coronoid process of the ulna. It attaches laterally to the midshaft of the radius. Its action is in its name. Flexor digitorum superficialis is the only muscle of the intermediate compartment. It has two heads. One originates from the epicondyle of the humerus, the other from the radius. The muscle splits into four tendons at the wrist, which travel through the carpal tunnel and attaches to the middle phalanges of the four fingers. This muscle has an action at the fingers and an action at the wrist. There are three muscles in the deep compartment, but in this unit we will only learn pronator quadratus. Being deep, it is not visible on our muscle models, but can be seen on the wet specimens and in images. It is a square-shaped muscle that originates from the anterior surface of the distal ulna and attaches to the anterior surface of the distal radius. It has one action. Muscles in the posterior compartment of the forearm are commonly known as the extensor muscles. The general function of these muscles is to produce extension at the wrist and fingers. The muscles that we are concerned with in the superficial posterior compartment are brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, and extensor carpi ulnaris. The brachioradialis is a bit tricky in that its origin is characteristic of an extensor muscle, but it's actually a flexor at the elbow. It originates from the lateral supracondylar ridge of the humerus and attaches to the distal end of the radius just before the radial styloid process. The muscle is most visible when the forearm is half pronated and flexing at the elbow against resistance. The extensor carpi radialis muscles, longus and brevis, are situated on the lateral aspect of the posterior forearm. The longus originates from the supracondylar ridge of the humerus and attaches to the posterior aspect of metacarpal 2 via a long tendon, while brevis originates from the lateral epicondyle of the humerus and attaches to the posterior aspect of metacarpal 3. There are 2 actions for each of these muscles. The extensor carpi ulnaris muscles are also situated on the lateral aspect of the posterior forearm. They originate from the lateral epicondyle of the humerus and posterior border of the ulna and attach to the posterior aspect of metacarpal 5. There are 2 actions for this muscle. Extensor digitorum is the main extensor of the fingers. It originates from the lateral epicondyle. The tendon continues into the distal part of the forearm where it splits into 4 and inserts onto each finger. The only deep muscle on the posterior surface that we need to learn in this unit is the supinator. The supinator has 2 heads of origin. One originates from the lateral epicondyle of the humerus, the other from the posterior surface of the ulna. They insert together into the posterior surface of the radius. Its action is in its name. In working out actions of these muscles, don't forget those simple rules we talked about earlier.